The Honorable Minister Subramaniam from from Malaysia, and I'm going to turn it over to you and ask that you give us the view from your really interesting recent experience in a number of key areas of intervention.
Thank you, Professor. Having heard many of my colleagues in the panel giving their views, I would like to sort of look upon the fundamental reason why we need laws in health. And so with that understanding, probably try to explore how the legal system, the health legal system in Malaysia has evolved over the years, and what are the opportunities which we feel we have for the future. As governments, I think it's the noble duty of all governments to ensure that people are healthy. And to ensure that this is achieved, governments very often require legal authority to do it. And to enable that this legal authority is provided, we look for laws and we create laws. But of course, in creating it, I think this has been alluded to by many of our other speakers. There is always this battle between the powers of the authority and its duties and the rights of the individual for their personal autonomy, for their personal privacy, and other fundamental rights which are to them. Trying to balance this to ensure that whatever government does is for the greater good, although it might to some extent impinge on individual rights, is something which is paramount. And to support this, of course, health laws are secondary to the constitutions of the country. And obviously the constitutions of the country have to provide the basis upon which these health laws can be evolved, so that it is in line with the national spirit with which the constitution has been evolved. In constitutional laws in which basic health rights are provided, then it is the duty of health laws to ensure that that provision of the constitutional right is made possible by the legislative support which it provides. And furthermore, in the globalized world which we are living in, we are also faced with international laws and agreements which gives us impetus to develop local laws which are in line with global agreements like the International Health Regulation and the Convention on Tobacco Control of the WHO, which gives us premise to ensure that what is done on a national basis is in line with international convenience and requirements. And of course, in ensuring such laws which are evolved provide the necessary answers, I think you, in your introduction, you did say that we want to achieve a certain end. Are we sure that this law will actually ensure that that end is met? That's a very difficult question. And it might take years before that question is answered. And that goes on to the fundamental question whether we actually evolve laws based on evidence that those laws are going to provide the answers which you're going to give. And I think recently the United States has started this public health law review or reference group, which is looking at the entire spectrum of public health laws and see how effective they are, what is the evidence which supports their continuous existence, and what are the changes which have to be done to make sure that they are effective. And that is, I think, is important for all nations. I mean, laws in Malaysia have been there for the last 70 to 80 years. While our colleagues are talking, I was trying to recollect how many laws which we have in our ministry to support the health system. I think we have about 25 different types of acts which actually regulate the professionals, regulate diseases, regulate drugs, regulate the sales of medicine. We have nearly about 25 different acts which has evolved over a period of time. And every time it's a response to a need. And while we see that response to the need, very often laws are political decisions, not scientific decisions based on evidence. And while being political decisions, we of course hope that political decisions eventually become decisions which will be backed up by evidence. But that happens sometimes it might not happen. So these are the challenges which we face, and I think in promulgation of laws and ensuring laws are effective in the public health spectrum, it is important to take this into consideration. And before I end, I just sowing the seeds for further discussion. It is the tremendous potential which laws have, particularly in the control of NCDs, like what Japan touched on just now. I think all of us are here involved in tobacco control. And maybe we can spend some time discussing about that and the challenges which we face in the area and the realm of tobacco control. Then we are also dealing whether we have the right to create an environment which is sort of enabling for health. Last year, we hosted the World Obesity Conference in Kuala Lumpur. And in that World Obesity Conference, we had a debate whether preventing obesity is it the right of the state or of the individual. It was a very interesting debate. Whether the state should take upon itself its rights to make sure certain types of food are not available to the individual, or is it the individual who has got right to make the choice whether he has to eat it or not to eat it. The approaches are totally different. But of course, this is an issue which is debatable. At the end of the day, of course, in a libertarian kind of attitude, you probably will take the later approach, say the individuals make the choice. But in a more authoritative kind of setup, where you got greater power, you might make sure that I will ban fast food outlets because they are contributing to obesity. These are difficult questions. So these are areas probably we have to discuss to see on a global basis. I think this is where I think WHO becomes important. Once WHO comes with a framework that gives other countries a kind of confidence that they're working on a setup which is accepted in an international norm. And with that confidence, they feel braver to move forward. And I think that giving that kind of confidence is very important. I think I'll stop there to allow for more time for discussion later on. Thank you.
Well, thank you.